Well, racial disparities in healthcare are a life and death issue, especially for pregnant African American women and new mothers. The numbers here really tell the story. According to the CDC, African American women are 3 to 4 times more likely to die during childbirth than white women. Right here in New York, those numbers are a lot higher. They're staggering. African American women are 8 to 12 times more likely to die during childbirth. So what makes matters even worse is that the CDC says 60% of those deaths are absolutely preventable. The risks African American women face continue even after the baby is born, and that is where our next guests are certainly making a huge difference. We're joined by Nana Eyeson-Akiwow and Marcia. They are co-founders of the Fourth Phase, which helps women heal after childbirth. Ladies, thank you so much for joining us, especially on this week, which is Black Maternal Health Week. We appreciate your presence here.
Thanks for having us.
Of course. So, Marcia, let's start with you and kind of giving us some perspective on those aforementioned statistics. Really shocking, especially when you look at New York City, New York, right, which is a melting pot of so many ethnicities. African American women 8 to 12 times more likely to die than white women. Can you shed some light as to why these numbers are so high?
You know, it's shocking to see the numbers so high in the city of New York, which it has such vast capabilities and is one of the top metropolis of the country. And, you know, the research really shows that the reason why there's such a huge disparity is really boils down to medical professionals not taking the needs and concerns of African American women as seriously, no matter where they are on a social economic scale, as seriously as they would the white women counterparts, and that has been the primary problem. And so, if you're not looking at the actual issues of high blood pressure, and when her blood pressure reaches a higher rate, that gives her a more chance to become predisposed to preeclampsia, and that how that actually affects and may affect her ability to have a actual healthy birth. And so the concerns that African American women mothers are then projecting are not being heard, they're not being listened to, and as a result, their lives are becoming endangered.
Right. And I have so many African American friends who have had those hiccups, right, during their labor. If you are lucky enough to walk away with a healthy baby, the mom also being healthy, that's the Super Bowl. The baby is born. You think, okay, the job is done. But then there is the third trimester, or the final phase, which you call the fourth phase here in pregnancy. Can you guys talk about that, Nana?
Yes, the fourth trimester represents that period directly after she gives birth, up to 12 weeks, and sometimes even more of over a year. And that is when the mom's body is recovering from the act of labor. And so it's all of the things that her body goes through, and also that she goes through emotionally. A lot of women talk about not reconnecting with themselves and kind of losing themselves, because you go from being an individual to now carrying a baby. And now when the baby's out, you spend so much time with this baby. Oftentimes moms lose themselves. And so that's that period of the fourth trimester. And that's where we come in with the Fourth Phase box to help support moms recover in a more holistic way.
An amazing box it is. You gave us one of those boxes right here. Thank you so much. This is called, like you said, the Fourth Phase box. And in it, you have items specifically curated for moms during their postpartum recovery. There's 2 boxes you can get, right? Break it down for us. There's a belly birth box, which is for a mom who had a C-section. And then you have the vaginal birth box. What are these boxes curated to treat? Because you have so many goodies in here. You have lotions, balms. I see an essential body oil. How does this really address the issues for both the vaginal birth mom and the C-section mom?
So essentially, the vaginal birth box is to support a mom who's had a vaginal delivery. And so one of the things that's key in the vaginal birth box is the peri-soother. And that peri-soother is it's a vaginal bidet. And it's what moms will use after she's delivered, when she no longer can really wipe her Netherlands as easily. And so that's what she would use there. The other piece for the belly birth balm, you're actually holding one of the pieces. The belly birth balm is a helichrysum salve that we created to help mothers' incisions heal without scarring. And so those are some of the things that makes the boxes very different in that curating for what a mom goes through. So that's the postpartum panty. When you deliver, your bikini and your thong is out the window. And so you need a new undergarment
Right.
to hold all of the things that's going on. So essentially you're wearing a sanitary pad that's bigger than you've ever worn before. And so the postpartum undie is a really cool, comfortable underwear that's in a great color black, that's kind of seamless and fits really lovely on.
And these are items that are real. Like every postpartum mom needs these items. And I love that this box not only caters to women who live in America, but also in Africa, West Africa. Can you talk a little bit about the availability of these boxes? How can you subscribe? How much?
Yes. So the vaginal box is $165 and the belly birth box is $150. And both boxes, with the purchase of both boxes, does allow us to provide a box to women in sub-Saharan Africa and also provide resources to women experiencing homelessness here in the U.S. who have just had a baby. And that's through partner organizations, African Health Now, and Passion Meets Purpose.
Right.
And so the boxes can be purchased on our website, which is fourthphasebox.com. And it is not a subscription box yet.
Okay.
Wink, wink. But as of now, it is not a subscription box, and it is meant to be the ultimate gift that you give to a mom. Because mothers are accustomed to getting baby gifts, this is an opportunity to give mom something that she really needs and that'll help her through this time period.
Right. And like you ladies say on this gift card here, it really does take a village. That's not just applicable to kids, but really the mother needs to be tended to. And I love that you guys are knocking down a door of access, making this easy to access for women of all demographics, of all ages. Nana, Marcia, brilliant. Thank you so much for being with us.
Thank you for having us.
Of course.